All right, good morning. My name is Jess Langer. My pronouns are she, they. As a quick visual description, I'm a white woman with brown hair, wearing green framed glasses, a white jacket, and a floral print top. You might see my little white and orange dog Watson pop up on my screen at some point too. I am joined today by my colleague, Brenda Schaefer-Pellinen with the Arrowhead Area Agency on Aging. Brenda will be managing our technology and chat. And we'd like to welcome you and thank you for joining us today for Mental Health and Aging, Thriving Through Life's Later Stages. Next slide, please. It's just some housekeeping items as we begin. We are excited to announce that today's webinar will be accessible to a wider audience. We have arranged for ASL, American Sign Language interpreters, who will be present throughout the session. Interpreters will rotate every 15 to 20 minutes, ensuring that everyone can follow the content effectively. To access the interpretation feature, simply click on the interpretation button on the bottom of your screen. Additionally, we are recording the entire webinar with the ASL interpretation, and the recording will be available on our YouTube channel for later viewing. Whether you attend the live session or catch up later, you'll have the opportunity to engage with the material in a way that suits your needs. I encourage you to subscribe to our YouTube channel so you can keep up with our latest editions. We are always looking for suggestions for future webinar topics as well. If you have suggestions for topics or speakers, you can feel free to send those to Brenda at her email, which she will share in the chat now. Please keep your microphone set to mute today. And just a note, if you experience any issues with your bandwidth or audio quality, if you have your camera on, it helps if you turn that off so that it's not taking up that bandwidth. If you'd like, please enter your first name and organization or county or community that you're from in the chat box, what you're hoping to get out of today's session, and how you found out about it so we can learn a little bit about each other. If you have any questions during today's session, please feel free to enter your question into the chat and we will address them at the end. We will also take some additional questions at that time. At the close of today's session, you'll see a quick evaluation of today's session pop up in your browser once you leave the meeting. Please take a moment and complete that survey. It helps us greatly when planning future sessions. And one last quick reminder, you can visit our Facebook page for more information about upcoming sessions. You can also check out our website at arrowheadaging.org. We have an exciting week of programming coming up in April as a part of our Get Your Ducks in a Row campaign. We have 5 webinars running April 13th through April 17th, all at 10 a.m., and they cover topics like healthcare directives and power of attorney, charitable and family legacy planning, understanding the dying process, and mindful decluttering. You can visit ducksinarowmn.org for full details and registration links for each session. Next slide, please. A little bit about the Arrowhead Area Agency on Aging. The Arrowhead Regional Development Commission is designated by the Minnesota Board on Aging as the Area Agency on Aging for the Planning and Service Area under the authority of Title III of the Older Americans Act. The Arrowhead Area Agency on Aging is committed to helping older adults maintain their highest level of independence. Area agencies on aging are regional organizations that provide the services, supports, and information for just about everything that older adults and their families could need. Minnesota has 7 area agencies on aging across the state that are the local connections to older Minnesotans and the community support they need as they age. The Arrowhead Area Agency on Aging's planning and service area includes the counties Aiken, Carlton, Cook, Itasca, Koochiching, Lake, and St. Louis. Next slide, please. All right. And so now I just want to read our Arrowhead Area Agency on Aging land acknowledgement. As we support our mission to help older adults maintain their highest level of independence, we do this while being respectful of the space we are being welcomed into by Indigenous people. We strive to deepen our understanding of the multiple ways in which people see and understand land and acknowledge the Indigenous people who have relationships with this land. We also acknowledge the decades of historical trauma, loss, and grief experienced by Indigenous people. It is our promise to not only recognize these truths, but also take action to show support of our Indigenous elders, neighbors, and friends, and understand our place within the past, present, and future of this land. We know this is just one step in recognizing and honoring the sovereignty of tribal nations. Next slide, please. Now I'm pleased to introduce our presenter, Danielle Thornton, Community Health Education Coordinator at NAMI, Minnesota. Danielle holds a Bachelor of Science in Public Health, Community Health Education, and Creative Writing, as well as a Master of Public Health in Global Public Health. At NAMI, Minnesota, she leads education initiatives centered on mental health awareness and suicide prevention, with a strong focus on community-driven, accessible outreach. Today's session is an essential conversation about maintaining and improving mental wellness as we age, exploring common challenges, including depression, anxiety, grief, and social isolation, and offering practical strategies for building resilience, staying connected, and knowing when to seek support. Whether you're an older adult, caregiver, family member, or professional, we're glad you're here. Danielle, thank you for being here today to share your expertise on this vital topic, and I'll pass it over to you.
Great. Thank you, Jess. Good morning, everyone. As it was mentioned, my name is Danielle. I use she, her pronouns. I am a white woman, brunette hair, wearing glasses, and I am here to help facilitate this conversation around mental health for older adults. It's an important conversation I think everyone should have, regardless of age. And so I'm happy to be here today to help facilitate that conversation and encourage all of you to share as well. For those of you that are not familiar with NAMI, NAMI is the National Alliance on Mental Illness. We are a nonprofit who is dedicated to providing education, support, and advocacy. So after this training here today, if you're interested in learning more about NAMI or taking another one of our sessions or getting involved in advocacy for mental health, I highly encourage you to check out our website. Or feel free to ask me any questions, and I'm happy to help people get connected. So these are our learning objectives for this session and kind of the order of the content that we're going to cover here today. As Jess mentioned, we have people turn off their mics here today, but I'm going to encourage people to share in the chat as I ask questions, or if you have questions, just so we can engage with each other here today. So our learning objectives today is going to be to understand some basics around mental illness, recognize risk factors and warning signs of depression and suicide, identify stigma, discrimination, treatment, and recovery related to mental illness, and then lastly, talk about resources specifically to support older adults living with depression or other mental health conditions. So I have a couple kind of polling questions in the beginning of this session here, just to kind of help us see where we're all at in our understanding around mental health. This is a place where we are coming together to learn and to grow. And so we're not gonna, be hard on ourselves whether we know something or not. So please feel free to put in the chat, how many of you had a robust mental health education in the 10th grade health class, or really any type of robust mental health education? Feel free to say yes or no. I see one yes, no. So lots of no's. And I think, as I do presentations like this, no's are relatively common when asked this question. I'm really excited to hear that there's one yes. Hopefully the school system and other places can learn and, continue to advocate for more mental health education. But it's important to note that many of us never really fully had these conversations, right? Which is why so many of us might struggle to open up about mental health because we were never really taught the language or given the space to have that conversation. Another polling question for all of us is, what is the most common mental illness? And so out of these listed on the screen, what do you think is the most common? And go ahead and put your answer in the chat. I see anxiety, depression, anxiety. Yeah, kind of flip-flops, substance use disorder, depression. Yeah, so I do see the top three. Anxiety is the number one most diagnosed condition for adults in the United States. Just below that, we have depression, and then substance use disorder is the third common. Something important to note is that, some of these conditions can occur together, right? And so sometimes that might skew those numbers slightly, but anxiety is the number one mental health condition diagnosed. Another question for all of us. On average, how long do people with symptoms wait to receive help? And so again, any of these answers could be true depending on somebody's experience, but what do you think is the average? I see a lot of 5, 10, 10, 10. Yeah, so a lot of you that put 10 are correct. So people wait on average 10 years living with symptoms before seeking help, right? And so I think that just really shows, again, a reason why we need to have these conversations because many people still wait for a significant amount of time, sometimes even longer than 10 years, to actually receive mental health care. So when it comes to reasons why people might not seek help or go to clinical mental health providers, what do you think is the primary reason? Again, similar to the last one, these are all correct options, but what do you think is the primary reason that prevents people from seeking help? Go ahead and put your thoughts in the chat. All right, yeah, I see a lot of stigma. They feel they can manage it, access, stigma. Yeah, so again, there's all these answers are accurate. There are a lot of reasons why people don't seek help. But the number one reason why people don't seek help is stigma and discrimination. And that is something that NAMI is doing our best to help reduce that stigma, to be able to provide people with the space and the language to be able to open up about mental health and just talk about resources. So just know that, we are a resource for all of you as well. So when it comes to stigma, how we talk about things really matters, right? Because how we talk about something can either continue to perpetuate stigma or it can, make it more hopeful or inspiring, right, to talk about. So for a long time, how many people talked about mental illness, you can see on the right-hand side, those red words. These were types of words that people would typically use when talking about someone who lives with a mental illness. So afraid, weak, selfish. Feel free to put in the chat. Are there other words that you've heard before? Perhaps you've even used yourself. And again, we're not here to judge our past selves, but continue to learn and move forward. But I know a lot of people might use the words like lazy or they're crazy, right? All of those types of things. Um, I see Kate in the chat put vulnerable. Yeah, so for a long time, us as a society, right, would use words that have this negative connotation that would continue to perpetuate stigma. So individuals that are having a hard time with their mental health don't feel comfortable enough to actually say something, right, or have a conversation. For me personally, I grew up with a relative who went through some fairly significant mental health challenges. And I just remember, you know, thinking back, how I'd be really judgmental, how I'd be like, this person is really lazy. Why can't they just figure it out? And it wasn't until later in life that I have grown to come to have more understanding, as well as, going through my own mental health challenges, that I, realized that this person was going through a crisis period, right? And they needed help and support. So looking back, I can see how resilient, right, this individual was. I can see how determined they were to overcome so many obstacles in their life. And so it's important to, lean into that hopeful aspect when talking about mental health conditions or just individuals in general, right? Overall, people are very resilient. People are courageous, determined, all of those things that any of us, regardless where our mental health is at, um, can evoke these positive things in our life. So that's really why we want to pay attention to how we talk about mental health. So, kind of giving us a good foundation of what mental health and mental illnesses are. And I think this is important to mention because oftentimes I still hear people kind of use these terms interchangeably, right? So, mental health is a state of mental well being that enables people to cope with the stresses of life, realize their abilities, learn well, work well, and contribute to the community. So, mental health is something that we all have. It is not good or bad, right? And it can fluctuate throughout our lifetime, depending on our experiences, our access to resources, so on and so forth. Then we have mental illnesses, and these are conditions that affect a person's thinking, moods, feeling, and the ability to relate to others. They are medical illnesses whose symptoms are behaviors. Mental illnesses are treatable. So, when talking about mental illness, it is important to acknowledge, in particular with older adults, that they often have several co-occurring disorders, right? And this just means that whether it be multiple mental health conditions that they're experiencing, or if they're experiencing poor physical health, right, due to aging or other, changes in health and well-being as we age, or thinking about substance misuse, right? And not just older adults, but a lot of people, we know that individuals that live with mental health conditions such as depression or anxiety have an increased risk of substance use. And this is because, sometimes people will turn to substances to help cope, or perhaps the use of substances can heighten the symptoms of mental health conditions like depression or anxiety. Um, and so it's really important when talking about, treatment for mental health conditions, especially for older adults, that we take this whole person approach, right? We can't just treat one aspect and assume that this other aspect of their health and well-being will also improve, right? Or that it will resolve on its own. Oftentimes it needs to be addressed together. So this right here is depicting US adults with a mental illness. And this is from 2025. So again, kind of just showing the prevalence of mental health conditions for adults in the US. Again, anxiety on the top with 19.1%, as well as major depressive disorder right below that. Um, Then we have substance use disorder as well as eating disorders and schizophrenia. Although eating disorders are, not as prevalent as anxiety or depression, eating disorder is actually one of the most harmful mental health conditions just because of the symptoms and results that it has on the body. So, these are just some examples of different types of mental health conditions, but today we're going to focus a little bit more specifically on depression, just because it is very prevalent as we age throughout life. So, an important thing or distinction to make is this differentiation between major depressive disorder and situational stress-related symptoms. So, major depressive disorder is a serious mood disorder. It lasts longer and it feels more intense than everyday sadness, often impacting daily life for weeks or even months. Then we have situational or stress-related symptoms. And this is typically a short-term response to a specific event, like losing a job or going through a breakup or perhaps losing a spouse or a family member. And again, these are things that are very common for many older adults to experience and likely, having multiple of them occur within a shorter period of time. One thing that is important is that with situational depression or situational stress or symptoms, if not resolved, it can transition into major depressive disorder, right? So this is important to acknowledge how these very significant life events can impact our, mental well-being, and to address symptoms sooner rather than later. Again, it's important to note that sadness and grief are normal, right? These emotions can be very challenging to live with and navigate. And just know that if, grief is something that you are navigating, know there are resources and support available. And grief can be relatively complex, right? Oftentimes it can be layered by multiple experiences, such as loss of individuals or relationships, including partners or friends. It could be loss of independence for a lot of people who are aging. It might be loss of a home or change in a living situation. And so, again, these things, it makes sense that they can contribute to sadness and grief. Normal sadness passes, untreated depression does not. So it's important to really understand that, we all go through sadness and grief at some point in our life in some capacity, but if untreated, it can have very significant impacts on our mental health and well-being. So another kind of question that I'm going to pose for all of you, and I'm going to encourage you to engage in the chat, is what words come to mind when you look at this picture? So what are some things you think this person is thinking or feeling in this picture here? So go ahead and put in the chat. So I see a lot of sad, loss, fear, hopeless, lack of hope. Yeah, I see a lot of people, yeah, lonely. So one thing to note, especially for a lot of older adults, is that typically when they go to a healthcare provider, they tend to focus on, telling their provider about physical things that are going on, right? Like, I can't walk as fast as I used to, or I'm losing mobility in this area of my body, or I have chest pain, right? So physical things, which is important to note, but they don't often, talk about, symptoms or things they're struggling with their mental health, right? So some of these words that we just brainstormed, so like lonely, troubled, hopeless, these are all things, vocabulary, words that we can use to kind of hopefully um, equip us a little bit more and able to be able to share, if we are having a hard time with our mental health, right? And it can be really challenging in a doctor's appointment because it is a short amount of time. But making sure that we do, mention some of those things if they are things that we are experiencing. Because sometimes when we treat mental health conditions, it can improve our physical condition as well, right? And vice versa. So again, really focusing on that whole person treatment aspect. So thank you again for those that shared in the chat. Again, I think a couple of you mentioned the word hopeless, right? And I think that's a really key word that I think I really want to highlight, because oftentimes people living with depression or struggling with another mental health condition, one of the most universal emotions felt is hopelessness, right? And that is a really key indicator to ourselves, or if we're concerned about someone else, that we need to encourage that person to seek help and care, right? So even if you might not notice specific symptoms around mental health, a mental health condition, if you kind of just get this sense that this person is feeling hopeless or desperate or trapped, we want to pay attention to that. So moving forward, I'm going to walk us through some examples of symptoms of depression that we can, be aware of and pay attention to. So the first category, we have emotional symptoms. And so I kind of highlighted just a handful here that I see, more prevalent in older adults. So we have like things like sadness, again, because of a lot of hard things that might go on in life. We have things like anger. I know a lot of times, I've heard stories of older adults and even just older adults in my own life who have become a little anger or bitter because of frustration, right? Or, a lot of things are changing. And again, just because it's normal to feel those things doesn't, or just because it is common to feel those things, it doesn't mean it's a normal thing, right? So we do know there are things that can help people manage challenging emotions. And then that last one I want to highlight is that hopelessness, right? So hopelessness can kind of be embedded within any of these symptoms. Then we have some symptoms of disordered thinking. So again, these might be um, things that we might think of. Again, this is not an exhaustive list, but some examples. And I highlighted a couple that, again, I think are more prevalent for a lot of older adults. We have things like pessimism, impaired memory, and concentration. One important note around impaired memory and concentration is that sometimes these symptoms are mistaken for dementia by caregivers or families, right? And it can be kind of confusing. However, if it is related to depression and it is treated, right, likely some of those symptoms might improve or go away, right? So we always want to make sure that we're, considering that it might be related to mental health because mental health conditions are treatable. Then we have behavioral symptoms. So these are things like loss of interest or pleasure in activities, withdrawal from others is very common. Um, we see very high levels of loneliness, not just amongst older adults, but amongst many people. I believe it was the year 2023 that the Surgeon General released a report on the epidemic of loneliness. And so we know that human connection is so important and vital for our well-being. And if, we are struggling with our mental health, we might tend to self-isolate or withdraw from others, right? And that can be a very significant symptom that can have lasting impacts on our overall health. And so we'll talk about some strategies of what we might do if that is a symptom that you are navigating yourself. And then I also highlighted misuse of drugs and alcohol. Again, some of us, growing up might have learned to turn to alcohol as, a numbing or coping mechanism, right, to deal with some of these challenging mental health symptoms. So learning how to move away from those harmful coping strategies and come up with other ones, it can be really helpful in navigating symptoms of poor mental health. And then the last category of symptoms are physical. And so it can look like things like fatigue, lack of energy. I highlighted this third one, sleeping too much or too little. Sleep is so important, and it also can be very challenging, especially as we age, right? I know, for example, my grandma, she only sleeps like six hours a day, and that's perfectly fine for her. But again, she has a hard time, staying asleep for a long period of time. And so again, everyone is going to be a little bit different, but making sure that, whatever amount of sleep or how we sleep is determined, making sure that we, have the proper tools and resources to support a good amount of sleep, because if we're not getting the proper amount of sleep, it's going to be really hard to navigate mental health challenges if they come up or if we're navigating them in the present moment. One thing that I want to note is that, again, a lot of these symptoms can be symptoms of other health conditions, but if it's related to mental health and is treated properly, some of these things might lessen or go away. All right. So now we have some risk factors for depression. And, looking at these risk factors, it can feel a little overwhelming because there's a lot of things that, heighten our risk for depression or just poor mental health in general. And so I want to highlight these because it's important that we're aware of them, but then also make sure that we know that there are things that we can do to lessen the risk, right? Even if we do experience these things, there are things that we can do to kind of mitigate or buffer the results or the effect of some of these risk factors. So I'm just going to kind of walk us through some examples. If anyone else wants to share in the chat some other things that might be a risk factor for poor mental health, please feel free to put in the chat. I think we can, learn from each other as well. So I want to just highlight this on the left-hand side, the very bottom. Again, I mentioned loneliness a couple slides ago. And again, really just highlighting that, especially for older adults, people maybe they've lost, relationships that they used to have. Maybe they had to move away from a home, their community. And so loneliness is very common for a lot of people going through big life transitions. And so acknowledging how that might have an impact on your mental health and proactively, seeking connection can be one way we can help lessen this risk factor. Another one I want to mention, being specifically in Minnesota, so lack of exposure to bright light in the winter. And that's that fourth bullet point on the right-hand side. Some of you might be familiar with the term SAD, so seasonal affective disorder. And this just really just talks about how lack of sunlight, during the winter months can just, lessen our mood, right? It can be a little challenging. And so there's different things that we can do, like a sad light, still getting outside, even if it is, a little bit not as bright, we can still get sun through the clouds. So doing what we can to get outside can be one way we can lessen this risk factor. So I'm just going to check the chat because I see a lot of people, or I see a couple people. I see grief, loss of physical abilities as individual age. Yeah, so those can all be risk factors of depression. And we'll give some examples of how we might navigate some of these risk factors. Yeah, Julie said communication impairments. Yeah, not being able to communicate how you used to. Or maybe you're able to, think through things clearly, but you're not able to physically communicate. It can be a variety of things. So just acknowledging a lot of these, challenging things as we age. Again, no one is going to be completely immune from challenging or stressful things, but there's also going to be things that we can do to help protect our health and well-being and promote health and well-being in our life, despite these things happening as we, get older. So on the flip side of the risk factors, we have protective factors. So these are things that we can do to help support our overall health and well-being, and again, lessen the negative impact of some of those risk factors that I talked about on the previous slide. So we have individual protective factors, so things like effective coping, problem-solving skills, having a strong sense of cultural identity, or just identity in general can be a really important factor. I'm going to walk us through some examples of coping strategies, and I'm going to encourage people to share, things that they use themselves. We have relationship protective factors. And so, I talked about how loneliness is a risk factor for depression or poor mental health, but healthy, strong relationships are the number one predictor of well-being, right? So even as our relationships kind of shift and change throughout life, taking the time to nurture, new relationships, acknowledge how old relationships might shift can be a really helpful thing in, promoting well-being. And then community protective factors. So these are things like feeling connected to school or community. Maybe for older adults, it's living in a communal area, feeling connected in that community or within a family community. And then lastly, availability and access to quality healthcare. So all of those things are going to help mitigate some of those negative outcomes from risk factors. So one really hopeful statistic that I like to share with all of you is that over 80% of older adults diagnosed with depression can be effectively treated. So just know that if you are someone who is navigating depression or intense sadness or grief, know that people can get better, right? There is hope. There is help available. So what are some things that can help? Again, I'm going to encourage people to share in the chat as well. Like, what are some things beyond just this list here? But we have things like therapy, medication, education. That's one thing, mental health education. That's one kind of area that NAMI focuses on. So maybe it's taking more of our classes or classes from another organization. Eating a nutritious diet, right? Having good whole food, quality food, can also help not just our mental health, but physical health as well. As I mentioned before, positive coping skills, social connection. For some people, it might be spiritual or religious support, and then also engaging in hobbies or things that bring us joy. So I'm going to just check the chat. I see a couple people put in a couple. Yeah, Kate mentioned resiliency skills built over time. Yeah, so resiliency, I like, Kate, how you mentioned it's a skill, right? Many of us think like we're either resilient or we're not, but it's actually a set of skills that we can develop over time, right? Even if we're older as well. Um, Donovan said, I think there's something important to note about the positive impact reminiscing can have for some while not getting too attached to the past. Yeah, so maybe positive memories, that can be really helpful. Also engaging in some sort of reoccurring physical activity at each individual pace or comfort. Yeah, so maybe it might be walking outside or riding a bike. Um, and then Casey said volunteer opportunities to provide a sense of purpose. Yeah, I think Casey, you mentioned a really important aspect is that purpose can come from a variety of different spaces, right? Many of us, I think, put a purpose attached to our job. And maybe as people age, and they retire and they move away from things that once, gave them a purpose, it can be really hard to kind of navigate those transitions. Or perhaps you had a purpose as a caregiver, right? And maybe now your children are older, right? And so, not saying that you still don't have a purpose with them, but those dynamics change as we move through life. So just knowing that purpose can come from a variety of different areas, such as volunteering, can be really helpful in navigating, finding a new purpose as we age. So, as I mentioned, positive coping skills can be really important in terms of maintaining or promoting good mental health for ourselves, also, navigating challenges, and then also, building those skills of resiliency over time. So again, I'm going to encourage people to put in the chat what are some, positive coping skills that you use. Again, hopefully it can be inspiring for the rest of us on this call. One thing I want to make note of is that a lot of these positive coping skills can actually be taught through therapies like CBT, known as cognitive behavioral therapy, or DBT, dialectical behavioral therapy. So if these are things that you are wanting more, one-on-one support in learning, know that therapy might be a really great option for you. But also know that a lot of these skills can be taught on your own, right? It might just take a little bit more, self-exploring, and, self-teaching. So kind of depending on your skill level or what you're looking for, there's kind of a spectrum of ways that we can engage in these coping skills. One thing that I want to highlight is towards the third from the bottom on the left-hand side, practicing gratitude. I think this is a really important skill, positive coping skill that we can engage in. It might look like a variety of different things for different people. For me, I have a gratitude journal and I live with depression. And so sometimes when I'm having a really hard time, I still try to turn to that gratitude practice that I try to do every day, regardless of how I'm feeling, right? So when those, challenging days do come, I have this kind of practice that grounds me in things that are still good, right? That are happening. And so that's one thing that I utilize to kind of help, manage, challenging emotions or situations. I see Patty mentioned exercise, breathing techniques. Meditation can be really helpful for a lot of people that kind of, might link to practices of mindfulness or gratitude. Um, Resilience around having a positive or hopeful mindset. Yes, this can be really helpful. We do teach a class at NAMI called Positive Psychology, and it really just talks about how individuals that think more positively or are more optimistic tend to have, higher chances of a healthier life later on in life. And this doesn't mean, suppressing negative things or ignoring it, but it's about being practical, right? So acknowledging the hardships, but still choosing to reframe it, or acknowledge it in a positive way to help us grow and move forward. So that's a great example too, Donovan. So I'm going to share just a couple resources on, if you are needing more support around, learning about mental health, things like that. These can also be, coping strategies is, reaching out to organizations or places if you need to talk to someone. So these are not crisis resources. These are just resources that can help with mental health or if you have questions. So it can be some great, organizations to turn to. So first we have the Minnesota Farm and Rural Helpline, as well as the Farm and Rural Mental Health Counselors. So that's on the left-hand side of the screen. And those are resources for people that live in, greater outstate Minnesota, where, lack of access to, mental health care or a lot of healthcare in general is an issue, right? And so some of these resources hopefully can help support individuals in those areas. Then we have on the right-hand side, we have Fast Tracker link to Minnesota mental health care. So one barrier that a lot of people face when struggling with mental health is finding providers that have availability. So this website, you put in the type of resource you're looking for, and it filters by your geographic location and only shows you providers that have availability. So it kind of just helps you fast track getting connected to support. And then, of course, the last one, we have the NAMI Minnesota helpline. That's through my organization. Again, it's not a crisis line, but we're here to help answer questions or support people in navigating resources for their mental health. So this next section here, I'm going to talk a little bit about suicide and crisis resources, right? And these topics are really heavy topics. And so if you need to step away, if you need to, seek care or support yourself, please take care of yourself. Know that NAMI is a resource for you. And there's a lot of other resources that can be helpful too. But I just kind of wanted to preface that before moving forward here. So this graph here is depicting suicide rates by age in the US from 2015 to 2020. And one thing that I want to point out here is that this bottom yellow line are individuals ages 15 through 24. So I think one important thing to note is that a lot of the times when we hear the topic of suicide, it's, kind of around younger individuals, right? But actually, the data and, working in this field of mental health suicide prevention, we know that suicide risk actually increases as you age. And so this is not to scare anyone or make anyone feel overwhelmed. It's really just to acknowledge that, we all experience different risks of potentially thinking about suicide, and it can increase as we get older. So it's important that we, talk about mental health and get help and resources, the sooner the better, right? To help prevent someone from escalating to a crisis period. This graph right here is depicting suicide in older adults. On the left-hand side, we see individuals between the ages of 55 all the way to 85 and older, and these are male individuals. Then we have on the right-hand side, we have that same age brackets, but this is showing women. And so this graph right here really just shows that men, especially older men, tend to die from suicide at much higher rates than women. However, one thing that this graph doesn't show is that women actually attempt at higher rates, and this has to do with lethal means. So oftentimes men might use firearms, which is a very lethal mean. And so this is why it's important to talk about, lethal means safety, as well as how to store firearms properly and all of that. If someone is in a crisis period, how do we keep them safe? And again, this is really just a quick snapshot. But again, if you're interested in learning more about suicide prevention, that's one whole area that we focus on at NAMI. And so I definitely encourage you to take one of our suicide prevention classes. So some warning signs of suicide. So if we notice one of these things or a couple within ourselves or maybe someone else, we want to intervene, right? We want to support them. So we see this third bullet point, feeling hopeless, right? This can be a very significant sign for experiencing poor mental health, right? And if not treated or addressed, it can escalate to a more crisis period. It might look like feeling worthless or a lack of purpose. withdrawing from family and friends or society. So again, a lot of these things are very common for depression or other mental health conditions, but if untreated, can escalate to a more serious crisis situation. So, what are some things that we can do if we are concerned that somebody is in a mental health crisis? The first thing we want to do is to ask about your concerns, right? Um, a lot of people fear that if you ask about suicide, it's going to plant the idea in this person's head. And we know that's not true. People are either thinking about suicide or they're not. And so it's really important to ask. And hopefully you're wrong and maybe they're struggling with something else. But if they are thinking about suicide, we want to intervene. Another really important thing is to listen to their problems, right? It can be really tempting to try to figure out their issues they're going through or to be like, no, 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 you don't want to do this, right? But in that moment, we need to give people time. We need to give people space. So validating what they're going through, empathizing can be one way we can support someone in a crisis. And then lastly, seek expert help. Don't try to navigate a crisis situation on your own. So what are some resources you can turn to for help? First, we have the county mobile crisis teams. So every county in the state of Minnesota is covered by a mobile crisis team. Some teams cover multiple counties, so depending on where you live, response time or resources might vary. So one thing that I always recommend is have to program the county mobile crisis team for the county you live or work in into your phone. Just in case you ever need it, you have it available. So unfortunately, there's not one universal number. So they're different depending on the county that you live in. So always I recommend putting the county crisis team in your phone. You can find the phone numbers at justcallmn.com, or you can scan that QR code, and I'm happy to share this slide out after if people want to pull that up after the session here. Another resource for people to know about is 988. And so this is a confidential support system for anyone in emotional distress. So if you yourself need mental health support, you can call, but also if you're the support someone or you're the support person who is trying to help someone, you can also call. And so again, it's free, it's confidential. They don't, track your data or know exactly where you're located unless you tell them, right? They might know your geographic kind of like area depending on your area code of your phone number, but they don't automatically show up to your house or the school or wherever you're at. They can connect to mobile crisis if you ask for that, right? So this is a really great resource if people want to stay anonymous and want to keep information confidential and just need to talk with someone through some situations. And then lastly, we have 911. So in a mental health emergency, we always recommend using 988 first. However, if there's a weapon involved or if someone is in physical danger or you feel in danger, then 911 would be the right way to go. And so if you use 911, we always recommend that you clearly state that it's a mental health emergency. You can also ask for other resources such as a mobile crisis team during that time. Sometimes police stations have an embedded social worker, so you can ask for those resources up front. And just try to give as much information about the individual, their mental health, if they have any triggers, just to help responders have the most information to hopefully respond in the most appropriate way. All right, so as we get towards the end of the session here, I just want to share just a couple of general resources, not specific to suicide or crisis prevention, but just some general support that you yourself can utilize or someone that you know to support your health and well-being. So we have primary care providers. This is often, the first point of access for a lot of people into mental health care. If you're connected with a faith community, or another type of community, leaning into those relationships can be really beneficial. If you are still working, asking if your workplace has an employee assistant program. Oftentimes, they have resources such as therapy or other mental health care that are low cost or free to the employees. So it's a great resource to check out. And then also know that NAMI Minnesota, we have that helpline I mentioned, as well as support groups if connecting with individuals is something that you're looking for. Some community resources. Again, at NAMI, we have family to family or hope for recovery classes, as well as mental health first aid. So if you're looking to learn more about mental health, you can also go to the Minnesota Department of Human Services to find more about mental health care and education. And then People Incorporated or Volunteers of America have some community mental health centers around the state. A lot of links here. Again, I'm happy to share these out after the fact so people can access them. Feel free to take a screenshot as well. These are mental health resources specific to depression. These resources here are really for people looking to learn more about depression or treatment options. And then we have resources for depression that are more clinical care, right? So if you go to Minnesota Psychiatry Society, they have like a physician finder tool. So if you're looking to find a clinician, as well as the Minnesota Psychological Association has a lookup tool for a lot of licensed psychologists. If you're looking for substance abuse and mental health support, checking out SAMHSA can be a great way to kind of learn a little bit more about what resources are available. Some senior specific resources. We have a Minnesota Aging Pathways, as well as area agencies on aging, which is part of this organization presentation here today. There's a senior recovery center, as well as Silver Sobriety or the retreat for individuals looking for chemical dependency support recovery. And then two more resources here. If you're looking for inpatient geriatric mental health units, there's a list here of spaces that might be able to take people in different areas of the state. And then this Friends & Co. is a nonprofit program who connects older adults with like kind of a companion, right? Or someone to talk to. So their coffee talk program connects people to have a caring conversation, right? So again, if you are someone who is navigating loneliness or isolation, this program can be a great one to connect with someone and just share a conversation. And then lastly, grief resources. As I mentioned, as we age, as we navigate through life, loss is part of that. And so, there might be times where we are navigating grief ourselves. And so some organizations that can be of support around that could be Brighter Days Family Grief Center. There's a variety of different conferences around grief to learn a little bit more. And there's also Growing Through Loss groups as well, if you're looking for that peer-to-peer support around the topic of grief. And with that, that is the end of my session here today. Again, a lot of resources, and I'm happy to share these slides out if people want to have access to those resources, be able to click through them. I'm happy to share that after this session. But for now, I'm just going to open it up for any questions or discussion that anyone has here this morning.
Thank you so much, Danielle, for your thoughtful and informative presentation. I don't know that I saw any questions in the chat thus far, but I'll give a chance for folks to put them in now.
Sounds good. And if anyone wants to just talk one-on-one, or has a question that might take a little bit more time to discuss, I'm happy to connect. My email is here on the slide as well as my number through NAMI. So please don't hesitate to reach out if that is something that would be helpful.
Wonderful. We're getting a lot of great presentations, good jobs, great information in the chat. Well, I will close this out. Just some key takeaways that I wanted to highlight from today's presentation. The importance of reducing stigma around mental illness, knowing the difference between normal grief, clinical depression, understanding that depression is not a normal part of aging, and recognizing that with proper treatment, over 80% of older adults diagnosed with depression can be effectively helped. I think those were some of my highlights for today. Um, some reminders before we close out. Like Danielle mentioned, if you or someone you know is in crisis, the 988 Suicide and Crisis Lifeline is free, confidential, and available 24/7. You can call, text, or chat. For that non-crisis mental health support, you can visit namihelps.org or call their NAMI MN helpline. And this webinar recording will be available on our YouTube channel for later viewing. Please don't hesitate to reach out to us, the Arrowhead Area Agency on Aging, if you have questions about resources in our seven county region. We encourage you to share what you've learned today with your colleagues and networks, and we'll be sending out a post-webinar email with the slides and a link to the recording once it is available. And you can see on this slide here, we've got all of our different ways to connect with us. But thank you again to Danielle and NAMI Minnesota for this important partnership. And thank you to all of our participants today for taking time out of your day to learn with us. Your commitment to supporting mental health and well-being of older adults in our communities makes a real difference. So have a wonderful rest of your day. We will close out. Thank you.
Thanks, everyone.